There's also risks. So there's a 1 in 7,000 risk of the baby bleeding more heavily than is normal. And there's also a potential risk for infection. We don't see infection very often, but you're breaking the skin, so it's always possible.
Yes. How much bleeding would you normally expect from this procedure?
Tiny amounts. So maybe the size of a thumbnail on the
Right.
gauze. And that's usually mixed with saliva. So it's very minimal. Usually the frenulum doesn't have much sort of blood supply. It can just be a mucosal fold. And I think it depends on technique. And in terms of like the tools we use, the pro of using laser is that it cauterizes as it goes, so you don't get so much potential bleeding. The downside of it, I would say, and what I've seen and heard in practice, is that it can sort of damage the tissues around. And certainly some practitioners have said that the babies are more likely to have a feeding aversion afterwards. But as I had a conversation with a dentist who does laser, I think the tools in the hands of a skilled practitioner, it doesn't so much matter what the tools are. It's the skill of the practitioners that are using them that's really key to successful and minimal damage.
Yeah, I imagine that parents don't get much choice in that, though, do they? If they go through the NHS, they'll get sent to whoever. And of course, it's very hard to know how skillful your practitioner is.
Yeah, so in the NHS, it would usually be midwives doing it with scissors. And yeah, you're absolutely right. The skill of the practitioner is very, very variable. I would say the private practitioners are more skilled because it's their focus. It's what they do. We pay our insurance and we tend to do a lot of training. You know, we'll go to conferences and we keep upskilled because we're offering a service, and we're also CQC registered, and they're very hot on us proving, you know, our the standards of our service. Within the NHS, it might be someone who's brand new, who's just been signed off on the skill. And I find, because I've been doing it so long now, I sometimes see families that have been maybe not given the whole bit of information, or had a procedure done that hasn't been successful, or had procedures done that maybe weren't necessary. Because I think the more you know, the less procedures you do, because you know that it can be other things. If you're less skilled in feeding, you're more likely to cut the frenulum just in case.